This is grade 4 gynecomastia surgery with double mastectomy and free nipple areola grafts. Good morning, guys. We're here today doing a grade 4 gynecomastia surgery. And so I already did my markings. I want to talk to you a little bit about the thought process behind doing grade 4 surgeries. And so this patient, he's in his 60s. He came to me because he wasn't happy with his chest, the fullness that he had. As he's getting older, it's getting a little bit looser as well. And so the reason why I'm doing the surgery that I've marked here is because I'm not just treating the fullness in the chest, but I'm anticipating issues that he's likely going to have with skin tone as well as nipple position. So let me show you here. He's actually in very good shape, but the first thing when I saw him in consultation was how low his nipples are compared to where his pec is. His pec ends about here, and his nipple is about 2 inches below that. Not to mention, I was looking at overall his abdomen and his chest, and he's got a lot of skin laxity issues in the abdomen as well. And I had him lean forward during the consultation and saw that the skin was actually quite loose. And so doing small incision surgery, yeah, it might make the chest better, but it would also increase the risk of having a lot of contour abnormalities with the skin and the higher chance of doing a second surgery to tighten up that skin, which would leave him back to this place right now. So we discussed it and went over the options, and really he just wanted one and done, and this is the best option to do that because it's going to treat all the components, not just the extra tissue that he's got, but also the loose skin and definitely the low nipple positions. I mean, the nipples need to be up here, and there's no real great way to get them up here without removing them and sewing them up higher. Final incision is going to go underneath the pec here, and when you see, let me have you flex your pecs for me. When you see this, you can see how loose this is, but his pec goes down to here, and that's where I marked that lower incision here. It's gonna be a nice little curve right there to match his lower pec shape. So here are a little status update. I already took the tissue out on this left side here. I actually did adjust my markings. This was my preoperative marking, but it would have been too much skin to take out, so I brought it down a little bit to make sure that I can close with no excess tension. And so here's a nice anatomy lesson here. This is his pec muscle, really good pec. And you can see all the striations, and it bounces when I touch it here. Nice little lateral pec border here. And so what's going to happen now is I'm going to close this like this, and this incision then is going to run right along the lower border of his pec like that. A nice shape to that incision. Do the same thing on the other side, and then I'm going to bring in the nipple grafts and sew them in the right place, and we'll be done. So here we are, I have him sitting up, and I've already closed the incision, nice curved incision underneath the pec. I marked the new location of his nipple. His nipples used to be down here before, and now they're up here. I've already thinned out the actual nipple areola graft that I'm going to use, and all I have to do now is remove this skin and then sew this into position so his nipple is in the proper position, and it's going to be done for the surgery. So just finished this grade 4 gynecomastia surgery with bilateral mastectomy and free nipple areola grafts. And you can see now he's sitting up. The incisions are right here underneath the pec. Nipples, which were down here before, are now up in a normal location. His contour is really good. The skin is super tight now. It's really nice. And the reason why we decided to do this procedure was not just because of his age. He's in his 60s, not just because he had gyno, but also he had a lot of skin laxity. You can kind of see a little bit in his belly that his skin is a bit loose, and that was the same thing with the chest. And And the third thing is that his nipples were in a low position. So doing a minimal incision procedure in this guy would have increased the chance definitely that we would need a revision surgery to tighten up the skin, and it would never have lifted the nipples to where they needed to be. So, and using this ruler, you can see we gained about 4.5 centimeters or about 2 inches of vertical height by doing this technique, something you wouldn't have gotten just doing a regular small incision nipple lift. So he's doing great, addressed all of his issues. Just gonna put the rest of the dressings on, we'll be done. Until next time, guys.